Acuscope. We're going to be treating today some pain for lateral epicondylitis because it's very common. The first thing you want to do is take the conductive electrolyte gel and put it on just a little bit on what's called the grounder. And this is going to, as long as it's touching the patient's skin, it's not going to electrocute them or anything if it's not there touching the skin, but it actually completes the circuit when it's touching. So if it's not touching the skin, or if it's not getting good contact, the treatment's just not going to be effective. So I'm going to go ahead and put this under your arm, and you can just lay your arm on top of it. It feels a little bit cold. Okay, so up here, there are different things you can do. This is called a gain spectrum. There's a timer, frequency, threshold, but the intensity is here. The gain spectrum you always want as low as you can possibly get it and still pick up a reading from the patient's skin whenever you use the active probe. The intensity you want to keep as high as you can, as high as the patient can tolerate. Sometimes they'll be really sensitive, especially with edema and stuff like that, so you might have to turn it down, but 600 is the highest it goes, and you want to keep it at least that for certain treatments. Sometimes if you're doing like auricular points on the ear and acupuncture settings, you have to turn it down to 200. Sometimes you'll have to turn this up to be able to get a reading. Because this is a biofeedback machine, you'll always get a reading back from the patient, and it will show up here on the screen. So you might have to increase the gain spectrum to be able to get a good reading. This is a roller. We're going to take it and put some gel. I think I'm going to go ahead and put it on Debbie's elbow here. There's a tricky thing about it. You can never let the electrolyte solution touch where the grounder is, or touch the other solution on the bottom. So you're just going to gently rub, because somebody with lateral epicondylitis probably is going to be a little sensitive, a little tender. I have to increase the gain spectrum because you're not getting a good reading. A good reading is like 80 plus. Around 100 is really good. So we're at 40, 50 now, and that's pretty good. So I can go ahead and start treatment, and I'm going to go over here and hit mode 1 start. And just keep going in the same fashion, just around the involved area, the injury, or whatever tissue is damaged, or wherever they're having the most pain. There are a lot of different treatments that you can do with this, and a lot of different ways that it can be done. So that's the gist of it, and you do this at a frequency of 0.5 for 4 minutes, and then a frequency of 8 for 4 minutes. And the frequency of 8 is the one that's closer to the body's natural frequency. Patients don't really feel this. If they feel anything, they feel a little bit of a tingling. Do you feel anything, Debbie?
No.
Not at all. They usually don't. Just to demonstrate how much of an increased flow we got from those few minutes of treatment on Debbie's elbow, I'm going to show you when I touch down here on the top of her wrist. There's a reading of 79, around 79, around 80. I'm going to come up here, and this is right on her elbow where I treated, and it's about 105.